Free audio post-production by alphonic.com.
But that vaccine has significantly decreased the incidence of HPV-related cancers. So that's the head and neck cancers, cervical, vaginal, vulvar, anal. All of those are mostly caused by HPV. And so we still highly recommend getting HPV vaccine because it's going to protect from those high-risk strands of HPV that can increase the risk of cancer.
Hey, Tina.
Hello, Leah. So I got to tell you, I just personally finished listening to the episode because you did this interview with Dr. Godbee, and I loved it, and I couldn't stop listening. So kudos.
Oh, thank you. Yeah, no, it was really nice reconnecting with her. We used to work together, and so, yeah. She's such a huge fan of integrative medicine that, that made it, really easy.
Yeah, it's so great when we find those allies that are in conventional medicine that we can work with, and then really ultimately the patient gets the best possible care. So I just loved it. And, I'm just going to tell people what they're about to hear. It is all about gynecological cancers, ovarian, endometrial, which is also known as uterus cancer, and cervical cancer. And what I liked is that you actually, for every one of them, talked about symptoms people have early on and what should tell them to go to their doctor or their gynecologist, and how to reduce the risk of each of them. So I just thought it was really a lot of information for in a very short time. So
yeah, it was kind of like my idea for it was just kind of doing like a gynecologic cancer 101. I think it's something that a lot of people don't think about. And we also talk about the HPV vaccine, which is very important to her, as it is to a lot of providers, because there is so much misinformation going around it.
Yep.
So,
yep. And you also talked about hormones and what high estrogen does, or its implications in women. So yeah, I feel like you touched on a whole lot in a very short amount of time. So I really appreciate that. And it reminded me why and how you and I should probably continue to do exactly this, which is talk to true experts. I mean, we're talking to a gynecological oncologist who this is all she does. So when you go to someone and that's all they do, they're going to be what I would call a true expert, not just somebody who's an influencer online who's, I don't know, just AI'd the topic or something. I don't know. So I just had a true appreciation for the depth of knowledge. In order to distill knowledge and distill information down, you need to know it really well, which is why this was a good interview, because she's able to distill it down to simple take-home messages for the listeners. And you can only do that when you know the topic inside and out.
Yeah. And she's such a great resource, too. And what I found really surprising was when we started talking about the HPV vaccine, I had in my mind what all the controversy was because of what I've heard from, other providers and what I thought would be a major controversy with the population of patients that she sees. It was something completely different, and that really blew me away. I was really kind of surprised by her response. So,
yes, because you and I don't have children, so we're not in the conversations with other moms talking about what's going on with their 9 or 10-year-old. So yeah, we're not privy to what the common thoughts are around it.
Right. And I also didn't realize the age range for getting the vaccine was a lot different than when it first came out and what we were told would be the age range. But before I introduce Dr. Godbee, I want to read a review. We got a review on Apple.
Can I just say right now, those were really helpful. So anyone who's listening on this on Apple or even Spotify, because it says a little shout out with some words on there. Stars are great, but words are great too. They give us some more attention. They give us more traction in the search engine.
Yeah. So leave us a review, a rating, comment if you're watching this on YouTube. The more interaction, the more people get to listen to us and find us. So this is from Greener LA, and the title is How Did I Not Know About This Podcast? And they wrote, I love this podcast. Doctors Kaiser and Sherman do such an excellent job explaining need-to-know information in a way that everyone can understand, and it is fun. Thanks for continuing to share such important information for all.
Yeah. Yeah, and a little selfish piece of asking people to write is, that really is energy for us. Knowing that it's landing out there and helping people is why we do it. And so
Yeah.
any feedback people can give us really does, give us a little energy and fuel to carry on. Because here we are, in this September will be our 5th year.
That's crazy.
It is crazy.
But yeah, this was just kind of like, we talk about this anyways, let's just record it. And
Yeah.
so, yeah, here we are 5 years later. It's kind of cool.
Yeah, it's awesome.
Okay, so Dr. Natalie Godbee graduated from Howard University in Washington, D.C., and she received her Bachelor's of Science in Mathematics. She went on to get her Doctor of Medicine from the Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. She did her residency in obstetrics and gynecology at Henry Ford Macomb Hospital in Clinton Township, Michigan. And her fellowship was at Wellspan York Hospital in Pennsylvania, and that was her fellowship in gynecologic oncology. And she currently works at City of Hope in Atlanta, Georgia. So stick around for our conversation.
I'm Dr. Tina Kaiser, and as Leah likes to say, I'm the sciencey one.
And I'm Dr. Leah Sherman, and I'm the Cancer Insider.
And we're 2 naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the hosts and their guests are solely their own.
Welcome to the Cancer Pod. Welcome to the Cancer Pod, Dr. Godbee.
Thank you. Thank you for having me. I'm excited to be here.
We had a little chat beforehand. Dr. Godbee and I used to work together at then CTCA, now City of Hope in Phoenix.
Phoenix, yes, yes. And it was such an honor to work with you. I miss you so much.
Oh my gosh, I miss you so much. We had fun. It was a really good place to work.
Yes, and I honestly learned a lot from you. I don't know if I ever told you that, but I did. I learned a lot from you.
Oh, thank you.
Yeah.
Yeah, because for those who are not aware, CTCA as well as City of Hope has integrative services.
Mm-hmm.
And so they have naturopathic doctors, acupuncturists, and do you have massage therapists?
Not anymore. We used to.
Okay.
Chiropractor service.
Okay.
Mm-hmm. Mm-hmm. And then, of course, did you say nutritionists?
No. Oh my gosh. I can't believe I forgot the dietitians.
Yeah.
We had Samantha Peterson. Was she still there when you were there? She was on the podcast.
Yes, she was. Uh-huh.
Yeah, we had her on.
Oh, awesome.
Yeah. I forgot the diet. Oh, okay. I'm going to hear for that about that.
Those are good times, though.
Yeah, no, it was great. It was a lot of fun. I never asked you, like, what brought you to gynecologic oncology?
Yeah, I've always wanted to do women's health. Once I decided to go to medical school, I said, women's health, I have to be there. I have to be in it. There are a lot of women out there who need an advocate, and I want to learn about the female body, what we can do, and how to advocate for females. So that took me down the OBGYN route. And then when I was in residency, that's where I learned more about GYN oncology. And so I got to experience the surgeries, an awesome attending who taught me gyn-onc. And from there, I was like, I'm sold. This is where I'm supposed to be. This is where my heart is, to do oncology and support women's services. So that's how I became a GYN oncologist.
And so for the people out there who aren't familiar with gynecologic oncology, can you just kind of give a brief little synopsis of what it involves?
Yes. So it is a subspecialty of OBGYN. So we all do OBGYN training initially in residency, and then we go on to do a fellowship in GYN oncology. And so we focus on cancers in females. ovarian cancer, fallopian tube, primary peritoneal, uterine, cervical, vaginal, vulvar cancers. And we do the surgical interventions and the chemotherapy for them.
So you're kind of a combination of medical and surgical oncologist.
Yes, we often call ourselves unicorns because a lot of times from the hospitals where I've been, they didn't really know what department to put us in. Are we with the medical oncologist or are we with the surgical oncologist? Because we do both. So-
Right.
but yes, we're a combination of the two.
You mentioned that gynecologic oncology kind of combines a lot of different aspects because it is women's reproductive health.
Mhm.
And so there are a lot of organs involved. And so I wanted us to talk about just kind of like the three primary ones: ovarian, endometrial or uterine, and then cervical cancer as well. And we'll kind of talk about them and the risk factors as well as like reducing the risk.
Yeah, absolutely. Let's
Okay.
talk about that.
Okay. So with ovarian cancer, um, I mean, basically being born with ovaries, I would think would be a risk.
Yeah. And so, honestly, just like most cancers, ovarian is sporadic, right? So it's only about 12 to 15% that are genetic. The rest are kind of sporadic, just um, mishap. And we know that it starts within the fallopian tube. And so oftentimes you will hear us interchange fallopian tube cancer and ovarian cancer. Even though they're coming from two technically different organs, they're treated very similarly because they'll behave similarly and because the ovarian cancer comes from the fallopian tube.
And so for reducing one's risk, if someone was getting a hysterectomy or if someone had a family history of ovarian cancer or fallopian tube cancer, then
Yeah, so that's why we remove it, right? So if you've been to your gynecologist and you want your tubes tied, or if you're having a hysterectomy, they may offer to go ahead and take out the entire fallopian tube to lower that risk of ovarian cancer. Um, when you have a genetic mutation that increases that risk, like a BRCA mutation, and there are a few other ones, but BRCA is the one that most people are aware of, that increases your risk of ovarian cancer and fallopian tube cancers. So, in order to decrease that risk, we remove the tubes and the ovaries after you complete childbearing.
is there a connection with endometriosis and ovarian cancer?
Yes. So that came to light a few years ago. So endometriosis is that endometrial lining inside of the uterus that implants outside of the uterus. And a lot of females have it. Most times they'll present with like painful menstrual cycles. But we found that that can increase the risk of certain types of ovarian cancers. And there are a lot of different types of ovarian cancers. We mainly talk about the epithelial ovarians because those are the most common. But there are germ cells and sex cord stromal cells as well. But it's going to increase that risk of the epithelial type cancers.
So that's something that if someone suspects or does have endometriosis, then they should get more of a follow-up.
Absolutely. And at least what I always tell patients is to pay attention to your symptoms, right? It's going to be very important because ovarian cancer is one of those that we call like a silent killer because 75% of the patients are going to be diagnosed at a later stage because the symptoms not only are delayed, but once you start having symptoms, they often get misdiagnosed for something else. Maybe like a GI upset or that watch and wait and see what happens as opposed to working up. So some of those symptoms would be like bloating, nausea, vomiting, changes in stool, changes in urinary habits, pelvic pain, pressure. Those things might be a clue that something's going on, and you should definitely advocate for yourself to have it worked up.
I don't know if you remember, my mom had ovarian
I
cancer.
do remember, yeah.
Yeah, and she was diagnosed by her gastroenterologist.
Y So and that's quite often patients get referred to GI
Mhm.
because of the nausea, vomiting, and GI changes, bloating, and everything. They say, "Oh, this must be a GI issue," and
Right.
it's all just those ovaries. Yeah.
Yeah, yeah, that's we're a lot more complicated.
Yes, we
Like,
are.
anatomy-wise. So,
Yeah.
okay, so then with endometrial or uterine cancer,
Mhm.
um, genetics again?
Yes, that can play a role. Those BRCA mutations can increase the risk of the high grade uterine cancers. And then we have Lynch syndrome that puts you at risk for endometrial cancers as well. So because of that, now when the patient gets diagnosed with endometrial cancer, we test them all for Lynch syndrome because that's also related to colon cancer too. And we want to make sure that the patients get the appropriate screening done. And it also plays a role in the treatment as well. But yeah, so with endometrials, that one is usually diagnosed at an early stage because of the symptoms. And most times it will present with abnormal bleeding, discharge. The patients may have a change in their menstrual cycles where they're bleeding a little bit more, or postmenopausal where you've completely stopped menstruating and then all of a sudden you see spotting or you have this menstrual cycle. That's abnormal. I just want everyone to know that because I've seen patients come in saying, I had some spotting a couple years ago and they told me that I was just going through menopause, but you stopped bleeding 5 years ago. So that's not going through
Right.
menopause. This is abnormal. So definitely pay attention to the spotting, the discharge, and the bleeding, because that could be a clue that something's going on inside of the uterus.
And are there things that women can do to reduce their risk of uterine cancer?
Yeah. So again, if you have those genetic mutations, sometimes you can get the ultrasounds to follow the lining. Um, Again, follow those symptoms too so that a biopsy can be done. And then, recently it came out about hair products, increasing the risk of some uterine cancers as well. So, of course, you want to try to decrease the amount of chemicals being put into the hair because it can increase that risk of uterine cancer.
One thing that we were often referred to, as well as patients were referred to the dietitians, was to, at least when I worked in Indiana, um, was to talk about exercise, physical activity, as well as it's so controversial because there's that whole thing where women go to the doctor and they have a concern and they're told, well, you have to lose weight.
Mhm.
So, but with uterine cancer, that's actually a concern, is
Absolutely.
excess
That's
adipose tissue.
Yes, yes, that is a big risk factor, right? So I will say that majority of the endometrial cancer patients that I see are overweight. And we know that that adipose tissue, the fatty tissue, can convert to estrogen. And estrogen is what's feeding this uterus and making that lining grow, grow, grow into a cancer. So we want to decrease that exposure to estrogen. And you can do that by weight loss. And then now that I mentioned the estrogen part, when we talk about hormone replacement therapy, if you still have your uterus, you want to make sure that you're getting estrogen and the progesterone to it because that progesterone is what's going to protect the uterine lining.
So, speaking of hormones, one of the risk factors for anyone who has taken tamoxifen, for breast cancer,
Mhm.
that's one of the side effects that you read about.
Yeah.
So, would that also be just looking for spotting? If 'Cause
It
there's from
is.
my experience, there's no monitoring. Nobody's, checking your uterine lining.
Yeah, yeah. So that's very true. So tamoxifen, like you said, that's a common drug that we use for breast cancer. It is a selective estrogen receptor modulator, right? The SERMs. And so in the uterus, it uploads those estrogen receptors, and now the estrogen is feeding that uterus and it increases the risk of uterine cancer. And so we don't necessarily monitor patients on a regular basis who are on tamoxifen because we know their lining is going to be thick. We will do biopsies and ultrasounds if they start to become symptomatic. So if they're having pelvic pain, cramping, bleeding, spotting, then we start the workup process because otherwise it kind of leads to some unnecessary biopsies and unnecessary ultrasounds because we know the lining is going to be thick, right? So if you are on tamoxifen and have pelvic symptoms, then yes, you definitely should see a gynecologist.
Before we continue with the episode, I'd love to tell you about our community memberships. We've created 3 membership tiers. Each level has its own perks. Members get exclusive access to live YouTube meetups, and you'll be able to download practical cheat sheets packed with real-world tips for managing treatment side effects and navigating survivorship. Whether you're newly diagnosed, currently in treatment, living in survivorship, or supporting someone you love as a caregiver, we're building something really meaningful. Visit thecancerpod.com and click Join Us to explore your options. And you can gift a membership too, which makes a really thoughtful gesture for someone who could use the extra support. Okay, now back to our episode. Okay, so let's talk about cervical cancer.
Okay.
Cervical cancer, I think a lot of people know about it just because it's been in the news.
Yes.
But let's talk about some of the risk factors and things people can do to reduce their risk.
Right. So cervical cancer is mainly caused by HPV, human papillomavirus. And the biggest thing to reduce that risk, of course, is the HPV vaccine. The controversy around that vaccine is, will it increase the likelihood of my child becoming sexually active? Because HPV is a sexually transmitted virus. And the answer to that question is no. Kids do not become more sexually active after they get the vaccine. But that vaccine has significantly decreased the incidence of HPV-related cancers. So that's the head and neck cancers, cervical, vaginal, vulvar, anal. All of those are mostly caused by HPV. And so we still highly recommend getting HPV vaccine because it's going to protect from those high-risk strands of HPV that can increase the risk of cancer.
And the recommendation for the vaccine is for
Males and female.
right. It's for everybody,
Yes.
who
Yes.
is not yet sexually active.
Even afterwards, too,
Okay.
right? Because of the multiple strands that it can provide protection from. So the average age is usually around 11 or 12 when they're still seeing their pediatrician. They're getting other vaccines as well. They should get the HPV vaccine at that point. But if for some reason they miss it, then we can still catch them up later on because in certain situations, we can give it all the way up to 45 years old.
I didn't realize that. So it could be given that late. Okay.
Yes, yes. And up that late, it is a conversation to have with your physician or your provider to see your risk factors for it. Initially, it was for 9 through 26, but they moved that age up for patients who may be at more risk.
And from what I remember, I haven't, I'm still kind of remembering my gynecology, but a lot of the times HPV can clear.
Hmm. In our younger population, it can. And so that kind of goes along with the test for, right? Your pap smear that we're getting. Back in the day, when we first started doing PAPs, we were doing them like at the onset of sexual intercourse. So that would include teenagers. They would get their pap smear done, but we've learned that it clears in younger populations. So we moved that testing up to 21 before we start doing pap smears. And even still, in your early 20s per guidelines, you only need the cytology part of the pap smear. After you are over 30, then we start doing the co-testing with HPV and testing cytology or the
Oh, okay. Yeah, those are all new guidelines since I was in school.
Yeah,
So,
yeah.
I haven't had to keep up with that. So, but there's like so much to, because, the female reproductive system is so complex. There's just so much to
Mhm.
remember.
And we're learning so much more too, right? As we get into the microbiology part of it, just learning how these cells are working and everything, it teaches us more and then we can kind of change the guidelines up a little bit.
And then with all the genetics.
Mhm. Exactly. Exactly. Yeah.
So, and there are other concerns with the vaccine. And I wanted to reemphasize that it's not just cervical cancer. It is other cancers, like you said, like various head and neck cancers and vulvar, vaginal, and penile cancer as
Yes.
well.
Yes,
So,
absolutely.
I don't want people to think that they, you know, for whatever reason, like, they feel they're safe.
Right.
And not to scare people to say that everyone is at risk, but, people are at risk, and there's a lot of misinformation,
Mhm.
and there is cause for there's legitimate cause for concern when it comes to any vaccine, but there's
Right.
also a lot of misinformation.
A lot of misinformation. But you also have to look at how long it's been out, right? Geez, it's almost at 20 years now that the HPV vaccine has been out. So we have a lot of data on it and the safety of it. As with most injections and vaccines, you might get a little pain where you get the shot. But other than that, it's overall a safe vaccine to receive. And you have to remember, like, this is going to decrease your risk of getting a cancer.
Right.
Cancer is a completely different beast that you don't want to deal with. If you can lower the risk, eliminate the risk, you want to do it because I've seen some bad cases of cervical cancer.
Oh, yeah.
Yeah. Yeah. And
Absolutely.
the treatments that they have to go through.
Some of the things that because I was brushing up on my on my cervical cancer knowledge,
Mhm.
smoking can increase the risk, right?
Smoking increases the risk. Any immunosuppression does as well.
Like HIV.
Yes. Yes. Prior STIs.
Oh,
Increase.
chlamydia, right? Was it
Mhm.
chlamydia?
In
See? I feel like I'm being quizzed. This
Yes.
is great. And then I saw on one site, I think it was Mayo, it says access to healthcare is a risk factor, which I guess would be a risk factor for all of these cancers.
Right, because they're not able to get their proper screening done,
Right.
right? So if you're not getting your screening, then of course that risk is gonna go up, because you don't know what's going on in your body. Yeah. So yeah, that goes along with that new testing that's out.
So let's talk about the home testing for cervical cancer because typically a patient would go to their gynecologist and they would get a pap.
Mhm. Yeah, so just this year, the in-home cervical cancer test came out, and it uses a wand that patients can do at home, insert it and collect a specimen, send it off, and they have access to a healthcare provider who can review the results with them and then make further recommendations for them. So I think it's really good. Like you said, one of the risks is being in a rural area, not having access to healthcare. And so for those patients, you can order this in the mail, do your home test, get it shipped back off without having to go out and seek another provider. Um, so I think it's a good space to be in. It's a good opportunity. But there are some caveats to it, right? It does not replace your annual exam. You still need to see a physician. Um, and some people go to their primary care providers too for pap smears, like a family doctor, internal medicine doctor, because they can do them as well. But, at those visits, you're able to talk to someone about symptoms, other things that may be going on. They're able to do a full physical exam, listen to your heart and lungs, do breast exam, get a visualization of the female anatomy, do pelvic exams, which will test the uterus and the ovaries. And so that wand, it's not really doing that, right? It's only collecting cells for HPV, not the cytology part either. So, 5% of the cervical cancers are not caused by HPV. So you might be missing a few of them with just the in-home test. So, even if you decide to do your in-home test, I still recommend getting the full physical exam done because you don't want to miss something else.
And I would think that a concern would be if someone were to get positive results. Is there follow-up to make sure that they are seeing another a doctor actually to to help them, manage whatever's going on?
Right. So I know that that testing company, they have medical providers who can review the test results with you. But you're right. What if it comes back positive? Then what? Are you referred to someone locally? Are you kind of out there on your own to just find that provider? Hopefully, they have like a follow up system where they can ask the patients, hey, did you follow up yet? Or
Right.
they're just checking in. But yeah, that is another valid point that you would still need to, at that point, go in to see a provider.
Okay.
And that test is not really for everyone, right? So the pregnant patients who need pap smears, those who are immunosuppressed, those who have a history of abnormal pap smears or cervical procedures, those patients wouldn't necessarily qualify for that test. So you
Okay.
would still have to go in.
Okay. And so, in general, for the gynecologic cancers, the treatments can be, depending on the cancer, depending on the type of the particular cancer, the chemotherapy, surgery, and also radiation.
Right. Right. Yeah. And like you said, it depends on the type of cancer, the stage of the cancer, how we make our decision about which route we choose for a patient.
Okay. So this is the Cancer Pod, and we do talk about integrative medicine. And you have firsthand experience working with these integrative providers that we mentioned earlier.
Yes.
So, how do you see the integrative services working with what you do? Like, what benefits have you seen for your patients?
I love it, right? So, where I trained, we actually did not have the integrative services. So, like I said, when I started working with you out in Arizona, that was my first time. And I so appreciate it because it really and truly does help the patients, right? And I've seen it benefit the patients not only for those who are undergoing like chemotherapy and radiation, but also our surgical patients, right? And so they help with the healing process of surgery and then also the symptoms that patients will experience being on treatment and even the symptoms related to the cancer itself. And so I greatly appreciate you guys and I value what you do. I'm so happy to be at a center that has that integrative oncology.
Yeah, I really wish that it was available at more cancer centers.
Mhm.
Because
Mhm.
I know that we see the benefit, and it like everything, that some patients wanna see you and, they derive a lot of benefit, and some patients are like, "Nope, I don't wanna see you right now." It's kinda back and forth, but, yeah, I mean, we worked with patients to manage their hot flashes, right?
Yes. Yes, because we
And
put them in menopause.
yeah, and, the side effects from like you said, the radiation, whether it's the bowel changes or, like the pain that comes with getting radiation, the
Mm.
burns and
Mhm.
all of that, yeah.
Mhm.
And it is for being a naturopathic doctor, it is really complex,
Mhm.
because patients are getting multiple treatments.
Yes.
And so following with them as they go through each stage, it was, like, really important.
Mhm. And the other symptom that you guys help out with is the fatigue, because just about every treatment that I give will cause fatigue, and I always say, "Hey, let's put you in with naturopath consult."
Do y'all have an exercise program there? Is there an exercise program for the patients?
You know what? We don't. We do have like our physical therapy
Right.
team but I don't think that we do. That's not a bad idea.
Oh, because I helped implement that at Goshen when I was working in Indiana,
Yeah. That
and
would help a lot.
it totally
Yeah.
and our gyn-onc there would refer a lot of her patients, not only for, like, weight maintenance, weight loss,
Mhm.
but for the fatigue and other symptoms too. So, yeah, so I think that's really great that, you have firsthand experience, working with
Yeah.
integrative
And,
services.
honestly, some patients come in specifically to see you guys. A
Yeah.
lot of times they don't even want to see me.
And I know, because 'cause we're the ones that get asked, like, "So, how would you treat cancer?" And I was like, "I would go to Dr. Godbee." Yeah, for sure. That happened in Indiana too. Yeah, that's very common where patients go specifically because they have all of the, integrative providers there. So
Right, right.
if there is anything that you would say to somebody who's just been diagnosed with a gynecologic cancer, like, is there a piece of advice that you would give?
Yes. So I know that a lot of patients come in wondering, how long have I had it? How did I get it? Why me? Right? And I frequently tell them a lot of that is unknown. It's unknown. We can't change the past. What we must do now is deal with what we know and look into the future and treat what we have in front of us and remain positive. I truly believe that patients who have a positive outlook, even though they may know the outcomes, but the positive outlook plays such an important role in getting through the treatments and finding that support system. We have a team who connects patients with similar cancers so that they can have support. But it's also important to have those family members and friends who can support you too. And I know not a lot of people like to discuss their medical issues and health, but you need the support. You absolutely need the support to help you get through.
Yeah, yeah. And I think as well as with breast cancer, but from what my experience working with your patients, and, all of the gyn-onc patients, it's a really hard cancer to kinda all of them are hard cancers to wrap your head around. I mean, it's part of your sexual identity. It's part of being female or
Yeah.
feminine.
Mhm.
And with the gyn cancers,
Mhm.
it absolutely is part of, one's identity. And I think that's what I saw a lot
Mhm.
with especially working at CTCA with your patients, um, was like the mind body aspect.
Mhm.
It's something that really needs to be supported.
Absolutely. Absolutely. And that's too where that integrative medicine comes into
Mhm.
play because we didn't mention about the counselors that
Right.
are available, right? Which can help with that psychiatry as well.
Mhm.
Because it's tough. No one wants to hear the word cancer.
Right.
No one wants to hear that word. And it's like as soon as you hear it, everything just kinda sinks, right? And
Mhm.
so you definitely need that support to help uplift you as much as possible, right?
Yeah, absolutely. And I know I'm gonna hear from my friends who are, mind body counselors, and they're gonna be like, "How'd you forget us?" So
We don't forget you guys when we're actually in the room with the patients.
that's right. We're like, "Please, please, you do need that support." And people are reluctant, but I really do think and I know that it did benefit a lot of the gyn-onc patients because it is all of these cancers have so many different levels to it,
Mhm.
because it is sexuality, it is reproduction,
Mhm.
um,
Mhm.
it
And like you said, the symptoms that come along with it, right? Because 'Cause we're putting most of these patients into menopause, or even if they've already gone through menopause, some of the medication that we use causes menopausal symptoms. And so we all know that, women going through menopause, it's a different time period in our lives.
exactly.
Yeah, so it can be tough for patients.
Yeah,
Mhm.
yeah. Well, I really appreciate you taking the time to come and talk with us here
I am
or with me. taking the time to talk to me.
Yeah.
Yeah, it's really nice catching up with you.
It is. Same here. I'm so honored to be here. Like, I love this podcast. I
Aw.
love everything that you guys are doing, and I wish you much success with it as well. Very inspirational.
Oh, thank you. Thank you so much.
Well, that was an excellent interview, Leah. Thank you so much for taking the time to do that with Dr. Godbee.
I have been wanting to interview her, so I'm glad that I was finally able to connect. And yeah, it was a really nice review for me too, because I wanted to be on top of my game. And so it's been a while since I've worked with her, and so the whole experience is just she's the kindest person, and she's such a great doctor.
Yes, clearly she is an excellent clinician. It's just she's so present.
I think it's a good idea if people have listened to this episode to follow her on Instagram because she does continue to give out more information. Just the other day, she had a post about melanoma of the vulva, and it is not necessarily related to sun exposure. I did not know that. And it's really rare, but I know someone who has that or had it. So she does continue to give out tidbits. Her Instagram, her social media is, she mixes her personal life and her professional life, but she's got good info out there. So her Instagram is it's me _ Dr. So we'll put that in the show notes so people can follow her and continue to get this really good information.
Yeah. Yeah, I think that's really good. And it does change over time. So that's the other piece of that is, what's true today wasn't true 3, 5, or 10 years ago. So it's much better to follow somebody who is an expert than it is to try to figure it out yourself online. And you can limit the dates on Google, but it still doesn't do the same as listening to an expert.
Well, just from like the information that you got when you were in school, the information I got years later, and then practicing, and what's out there now, like guidelines change. So
Absolutely.
that was the other thing. So yeah, definitely follow Dr. Godbee. Let us know what you thought of this episode. Again, leave a comment if you're watching this on YouTube. Leave a comment and a review if you are listening to this on Apple or
That'd be great.
Spotify or iHeartRadio or wherever you're listening. And then follow us on social media. We are the Cancer Pod all over the place. TikTok, Instagram, Facebook, Threads. I don't know. We're
Yeah,
everywhere.
And if you'd like to, check out our website, because on our website we have some recipes, we've got some blog content, we've got links to a bookshop and some merchandise. And you can find a whole lot on our website as well.
Oh, yeah. Buy a t-shirt. Represent. Get a beanie.
I need to get a beanie.
I do
I don't
too.
have one yet.
I don't either. And on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time.
Free audio post-production by alphonic.com.